Good afternoon, everyone. This is Lionel Jones. Today we'll be discussing the Federal Flexible Spending Account Program. Again, my name is Lionel Jones. I work here in OPM in the healthcare and insurance section of our agency. My primary duties are as a primary contact for the FSAFEDS program. I also work on life insurance, a little bit of long-term care insurance, a little bit of dental vision as well. But I am the primary point of contact for the Federal Flexible Spending Account Program. And today I'm going to be going over our program. I want to note to you that this is an interactive program. If you have questions that you don't believe are going to be asked during or answered during the session, you can do so. You can submit those questions in our chat log. I have someone working with me today, the unbelievably kind Kathleen Healy, who's working to document your questions, and I will be addressing them at the end. So if something comes up, feel free to put your comment there. So to start off, the Federal Flexible Spending Account Program has its authority under Section 125 of the Internal Revenue Service Code. That is through the IRS. The IRS actually makes the regulations associated with flexible spending accounts, and it's up to us to follow them. It provides participants an opportunity to receive certain benefits on a pre-tax basis. So when you think of all of the intricacies of the regulations associated with flexible spending accounts, they're actually determined by the IRS. And we'll be discussing a little bit more about that later on, specifically about the changes that are recently occurred. But I just want to give you a heads up. So you may ask, how big is the Federal Flexible Spending Account Program? We are the largest flexible spending account program in the country. We have over 475,000 unique enrollees. That includes 440 healthcare FSA participants, 89,000 dependent care participants, and 10,000 limited expense participants. From those numbers, you can see there are some overlap. So you can have either a healthcare or a limited expense FSA at the same time, and a dependent care. So what is FSAFEDS all about? The Federal Flexible Spending Account Program is a benefit that's all about saving you money and your agency's participants money. So I'm going to give you a few examples of that. Starting out with Ted. This is Ted. He's a federal employee. Ted figures next year he'll be spending about $1,000 on three things: a prescription that he will get every month, office visits to his doctor. Nowadays, that'd be remote visits, and a new pair of trendy eyeglasses. His plan will pay part of the cost for his prescription and the doctor's visits, and his vision plan will pay part of the cost for the glasses. But altogether, Ted will have to pay about $1,000 out of pocket for these things. It's part of the cost of insurance it's part of the cost of insurance doesn't pay for it. So how will Ted pay that $1,000? He has two choices. He could pay for them without a flexible spending account, using just take-home pay from his paycheck. But his take-home pay is gross income minus several deductions, including tax deductions, like federal income taxes, which are between 9 and 28%, Social Security, which is approximately 6.2%, Medicare taxes 1.45%, and state and local taxes, which can be up to 10%. And that obviously depends on which state he is in. Because of taxes, it could take $1,400 of Ted's gross income to get $1,000 of his take-home pay he will be spending on his prescriptions, doctor visits, and glasses. But there's another way, and that's with FSAFEDS. Ted could pay for these things using the flexible spending account. He could set aside $1,000 from his gross income before he gets taxed. That $1,000 would not be subject to federal income tax, Social Security tax, Medicare tax, for most state income taxes. By using an FSA account, Ted would save $300 next year by not paying taxes on his $1,000 of income he uses for his healthcare expenses. Another example would be Rosie. Rosie is also a federal employee with 3 children, and she plans to spend $4,000 on daycare and summer day camp for them next year. How can she pay for that? Like Ted, she has 2 options. She could use her take-home pay in her paycheck, but after taxes, that could take as much as $5,200 of gross income to get $4,000 from her paycheck to pay for her daycare providers. If she uses a flexible spending account, she can set aside $4,000 of her gross income before she gets taxed. Rosie could save about $1,200 next year by not paying taxes on $4,000 of income that she uses for her daycare. So with all that said, how does FSAFEDS work? With FSAFEDS, you can sign up for a tax-free flexible spending account. You put a certain amount of money into it each pay period. You incur eligible healthcare or daycare expenses. Your flexible spending account then reimburses you for those pre-tax dollars you set aside. Over 475,000 federal employees are currently enrolled and save on average 30% on these kinds of expenses. The more eligible expenses you have, the more you'll save. So we're going to go over the 3 types of FSAs. The first and the most popular one is the healthcare flexible spending account. It covers you, your spouse, and children through the age of 26. Insurance helps pay for the many of these expenses, but part of those costs insurance do not cover. A healthcare flexible spending account program can be like a 30% discount. With a healthcare flexible spending account, you can use it for healthcare expenses, dental or vision care expenses, or certain other expenses. For instance, if you go to the doctor and you have a copayment, that would be an example. A prescription that you have would be an example. For dental and vision, it could be a crown, braces for your children, and so on. So here's some of the eligible expenses with a healthcare flexible spending account that you and your spouse and your children under age 26 can have paid for. Those include, again, prescriptions, doctor's visits, hospital co-insurance, immunizations, lab tests, ambulance services, dental care, physical therapy. There's also some nice ones that people don't consider, like chiropractic, massages. Those are also things covered by a flexible spending account. When you think of dental and vision expenses, that can be eye exams, prescription glasses, prescription sunglasses, contact lenses, laser eye surgery, dental exams, cleanings, orthodontia, and braces, just to name a few. Recently, there's been a change with over-the-counter medicines that now allow you to do that with the FSAFEDS program in all flexible spending accounts. So over-the-counter medications and drugs, massage therapy, diabetes testing supplies, first aid supplies, shipping and handling for eligible expenses, hand sanitizer, sunblock, aloe vera gel, orthodontics, blood pressure monitors, wheelchairs, walkers. These are all examples of expenses that could be covered under your flexible spending account program. So as you're placing a human resource, oftentimes you'll have someone come up to you and say, hey, I have $700 left in my account. It's November, it's December. How am I going to use this in time? I don't want any issues with potentially things happening to that fund, to those funds. You can point out to them that a first aid kit would be counted under FSAFEDS. That medications, over-the-counter medications, such as NyQuil, Dayquil, Tylenol, Advil, those are all covered. Allergy medication, Zyrtec, so on, Claritin, those could all be covered without a prescription. So a lot of people choose to stock up towards the end of the year if they still have funds in their account that they want to use. The second of the accounts is a limited expense flexible spending account. It's designed for people enrolled or covered by a high deductible health plan with a health savings account. If this is you or one of your employees, you already get a tax advantage for your health expenses. So this type of FSA only covers your eligible dental and vision expenses, not covered by other insurances. These are the same dental and vision expenses we discussed earlier under the healthcare FSA. So again, the LEX is only for high deductible people enrolled in high deductible health plans because they are not eligible to be reimbursed with that FSA if they are enrolled in one of those accounts. So they can only use a limited expense, which allow them to get reimbursed for expenses in dental and vision care. You cannot have both a LEX and a healthcare. It's either or, depending on what type of health plan you are enrolled in. The third kind of flexible spending account is dependent care flexible spending account. It covers what you spend on daycare for your children age 13 and under. I'm sorry, under age 13. Let me clarify that. Under age 13. And you can spend on daycare for any adult who is incapable of self-support, claimed as a tax dependent on your tax returns, and lives with you for more than half of the year. So think of a parent, a grandparent that lives with you that needs care because they have an illness that could be Alzheimer's, dementia, physical handicaps that you help take care of. You can actually have some of your care expenses for them covered under dependent care flexible spending account. And that can be an adult child, parent, parent-in-law, spouse, sibling, any adult that meets these criteria. If you wish to enroll in a dependent care account, you and your spouse must be working, looking for work, or attending school full-time. You and your spouse must earn income during the year, even if you're looking for a job, but not if you're going to school full-time. The work and income requirements do not apply to your spouse if your spouse is physically or mentally incapable of self-care. What I like to say is dependent cares are a little bit different than the other accounts, the healthcare accounts, where a qualifying life event is a change in expense associated with your dependent care. To give you a more recent example is during the current pandemic. If you have a dramatic change in your dependent care accounts, or one of your employees does, that is a qualifying life event to change your dependent care allotment. And a participant can do that through September 30th of each year. So they have from January 1st through September 30th to do that. So in a case where their child can no longer go to daycare, they can call our 1-877 number, 1-877 FSAFEDS, and at that point, they can ask to reduce their election, or let's say it's the exact opposite. They had a spouse that was at home, was a stay-at-home spouse, and that spouse got a job, and that spouse can no longer take care of your 11-year-old child after school. That would be a qualifying life event to add money or to elect a DC FSA for the period of time that you needed daycare for that child. So if it was after school care, to make sure that he or she would not be at home alone, and you use that time frame to work or your spouse to work, that would be a qualifying life event. So you ask, what are the eligible expenses with a dependent care flexible spending account? They include daycare, day camp, babysitting, Most eligible expenses can be found on our website, www.fsafeds.com. But here are some examples, which I just mentioned. One thing I like to point out specifically for this year is there are some remote camps, remote summer camps, where a child can, on a computer, access a day camp. And that's something particularly new for this arena because of COVID. So that would be a qualifying expense if that is used for you to work, go to school, so on, the examples I gave a little bit earlier. For your adult dependents, eligible expenses include any sort of non-medical daycare providers, like someone to help you with everyday tasks, help that person with everyday tasks such as eating, dressing, going for a walk outside, etc. So what are ineligible expenses? First, premiums. Every once in a while, we have someone that will say, hey, can I have my long-term care insurance covered under a flexible spending account? The premiums for that, no, that isn't. Premiums are not covered. Cosmetic surgery or procedures. I like to tell this story. In my first 6 months in my current position, many years ago now, I had someone that was extremely upset about expenses not being covered. They didn't want to be specific at first, but when we drew down to it, it was because this particular participant had rhinoplasty and expected to have that reimbursed. Of course, that is a cosmetic surgery, and that could not be reimbursed, so unfortunately I had to let her know that she could not be reimbursed for those expenses. For dependent care expenses, what are ineligible are healthcare expenses. So you can't claim your child's healthcare expense under a dependent care account. You can do that only under a healthcare flexible spending account. Services provided by your dependent. So you can't have your child do something and get reimbursed for that. Education or tuition fees. So we mentioned that daycare would be covered, after school care would be covered, but it's not an education. So it wouldn't be a tutor specifically. So if it's just a person that you're in a house and that tutor came by and was teaching your child or helping her with science or any other subject, engineering, that would not be covered. Same thing with tuition fees. Private school tuition fees would not be covered. One moment, looks like I have a question.
Lionel, along these lines, the question that came up was, what about during the school year, virtual after-school programs? Are they covered?
They can be covered. Virtual after-school programs can be covered if they meet the guidelines otherwise. For those type of things, what I would suggest is you have the participant, or you, if that's the case for you, you can reach out to us at 1-877-FSAFEDS, and we can help you identify if that would be an eligible expense. We have staff that are there from essentially 12 hours a day, Monday through Friday. We're here to answer questions. We're here to help. We're here to make things easy for every participant. So if you have any questions about an expense being covered, first, it's available on the website, www.FSAFEDS. But if you prefer to talk to someone and work through the issues associated with it, it again is 1-877-372-3337, and that equates to 1-877-FSAFEDS. I have another question.
Right, just since we are in ineligible expenses, another one is, what about cosmetic, dental versus orthodontic braces? So it does have that word of cosmetic, so can you please address that?
Okay. Orthodontics are covered. When you say cosmetic, there's some ambiguity in that, and I would need to have a little bit more examples for that. Offline, if you would like to contact me at fsa@opm.gov, I can certainly answer your question very specifically. But there are some situations where cosmetic items regarding dental care could be covered. But there's some lines there. We have to rely on the IRS regulations on this, and they have some specific, there's some dichotomies between things that can be covered and cannot be covered. And there's a line there. So I'd have to get a little bit more information. So if you can reach out to me, again, that email address is going to be a little bit later on, and I'll be able to help you out with that. This line? All right. So changes effective in 2020. All right, Public Law 116-136, the Coronavirus Aid, Relief, and Economic Securities Act, included two significant changes that affect participants with an FSA. First, as I mentioned before, over-the-counter drugs and medications can now be reimbursed through a medical FSA without a doctor's prescription. They were once available prior to the approximately 2014, 2015. Prior to then, you could have over-the-counter medications. That changed, and then now these are re-effective. So over-the-counter medications, anything associated with regular headaches, pain relief, those type of things are all covered. And we actually have a place on our website, www.FSAFEDS, where you can look up eligible expenses to give you a few examples of what they would be. All you have to do is put an over-the-counter, and it will show you all the over-the-counter expenses that are eligible for FSA. In addition to that, for the over-the-counter, yeah, the over-the-counter is henceforth. So that law actually changed FSA law, period. Congress can come in and change what the IRS has previously put out, any notices they previously put out. So this was actually a change in the law. Going forward, over-the-counter medications and menstrual care products can now be reimbursed without a letter of medical necessity. Also, in 2020, the IRS issued a couple notices that affect FSAs this calendar year. And this one is just this calendar year. For 2019 dependent care FSAs, that previously have to have all expenses incurred by March 15th of this year can now be incurred through December 31st. So again, this is only a 2019 DCFSA. So if an employee enrolled in late 2018 for a 2019 dependent care account, they had from January 1st, 2019, now through December 31st, 2020, to incur expenses against that account. This does not affect 2020 dependent care accounts. Unfortunately, this is something that we have to rely on the IRS to issue a change on, and we have not gotten any new information. When we do, we will certainly put that information out through a benefit administration letter and most likely through a listserv if something were to change, but this is only for 2019 dependent care flexible spending accounts. So who can enroll in FSAFEDS? So you must be an executive branch employee or must be employed by NC participating in FSAFEDS. You want to tell employees, if you don't know, some people may be with an agency that does not use FSAFEDS. How it works is executive branch agencies are required to offer a flexible spending account. FSAFEDS was created for that reason. FSAFEDS is the largest flexible spending account in the country, and as a result, we have the lowest fees associated in the country. So pretty much all agencies that can enroll in FSAFEDS choose to do so. There are a few agencies that are a little bit different that have their own FSAs, but I assume if you're on this call, it affects you and your participants. As a note, retirees are not eligible for FSAFEDS or flexible spending accounts at all. Flexible spending accounts are a pre-tax salary benefit authorized by the IRS and are for employees only. So the only way an employee, a retiree, would be able to enroll in a flexible spending account is if they were to get reemployed by an agency that has FSAFEDS. There are some additional eligible requirements if you want to enroll in a healthcare flexible spending account. You must be eligible to enroll in an FEHB plan in accordance with the laws and regulations, but you do not need to actually be enrolled in FEHB. Members of Congress and congressional staff may enroll in FSAFEDS. So what that means is if you have an employee that does not have FEHB, she is eligible for FEHB, but she's covered under her spouse's plan. That's a private industry plan. She would be eligible for FSAFEDS because she is eligible for FEHB, even though she has not taken it. So for dependent care accounts, you do not need to be eligible for FHB. Dependent care flexible spending accounts are even more widely available. To enroll in the dependent care FSA, you must be employed by a participating agency, but you do not need to be FEHB eligible. Please note that intermittent employees with no fixed work schedule, whose tour of duty is expected to be 180 days or less, are not eligible for dependent care accounts. Let me repeat that last sentence because I know I have a bunch of human resource officers on the line. Intermittent employees with no fixed work schedule, whose tour of duty is expected to be 180 days or less, are not eligible for dependent care flexible spending account. An example of that is seasonal firefighters. We have a bunch of firefighters that work only when there are forest fires in various parts of the country. So seasonal work where they're only expected to work, 30, 60, 90 days that year as needed, that person would not be eligible for it. So savings calculator. To figure out what the best amount to put into your flexible spending account, you can have employees look at our online savings calculator at FSAFEDS under the Quick Links button. When you enter, the employee will enter their salary, some basic tax information, and their estimated expenses. That's things that they know about. If they know they're going to have a procedure, going to need some dental care, their child will need a few cavities covered, maybe a prescription that you know about, $50 a month, $75 a month on a prescription medication. And that calculator will show you how much you should put in your flexible spending account and how much you could save as a result of putting money in your fund. One second, looks like we got a question on 180 days. Could you read that back to me, Kathleen?
Yes, the question is, if the intermittent employee ends up working more than 180 days in a year, will they become eligible then?
They would, because it's expected. But again, it's not going to be retroactive. So if they were to become eligible as a result of a change, it can be that, it can be an employee switches to another position where they are eligible. It's not going to be retroactive. So if they've had a bunch of expenses prior to then, it would not affect those expenses. It would only affect the expenses going forward. In addition, with a flexible spending account, you can only incur expenses while you are an active employee. So while it's 180 days, if they're only expected to do another 30 days of working, they would have to incur any of those expenses while they were still active. So to give you an example, that same firefighter, he is, it looks like he's going to be working longer than 180 days. So he works with you all, or his Human Resource Office, I assume, and gets verification that he can sign up. Well, he signs up and elects $500 for his healthcare flexible spending account. Well, 2 weeks later, all the fires are out and he is not needed any longer. That means he would have had to incur all of his expenses that he can incur within those 2 weeks. So if he did not spend that money, he would not be able to incur any more eligible expenses based on that. And if the next year, if he is likely to be seen as not being there for over 180 days, he would not be eligible to carry over that money. And we'll be discussing carryover in just another moment. So in those cases, typically people do not enroll unless they know they have a very short-term expense, them or their family has a very short-term expense that would be addressed pretty much immediately. When you think of an intermediate employee, that can end, for many cases, they can find out that same week that they're no longer going to be needed. And as a result, you don't want to have someone sign up for something that they cannot use, and then they'll reach out to me, they'll reach out to you and ask for an exception, which are not offered. So the minimum annual election is just $100. So you can sign up for $100, and that's for the whole calendar year. The healthcare and limited expense accounts, each participant must contribute a minimum of $100 to a maximum of $2,750. For dependent care accounts, each household must contribute a minimum of $100 to a maximum of $5,000. This program allows use of pre-tax withdrawals from contributions of $5,000 for a single individual or married couple filing jointly, or $2,500 for each married couple filing separate returns. So if you and your spouse are filing separate returns, you want to break that down to $2,500 each. However, that does not affect if both spouses are filing jointly. If both spouses are filing jointly, one spouse can do $5,000, they can do $2,000, they can do the maximum. So it's just a little jag in the law there. So when are funds available to be used? With healthcare flexible spending accounts, both the limited expense and the regular healthcare, total annual elections are available as soon as enrollment is effective. So to give you an example, if you have an employee that has a big procedure January 15th of 2021, he or she is definitely going to be doing it. It's all planned. It's going to be a really large procedure. They know that their copay for that, based on whichever plan they're with, will be $2,000. That person can actually sign up for FSAFEDS for $2,000, pay for it however they may, credit card, so on, and submit a request to be reimbursed before that money is deducted from their account. So if they did $2,000 over the year, that'd be the equivalent of about $150 a month. Let's say they had $75 taken from their account for the first pay period in the month, but they've already been reimbursed $2,000. So that would allow them to incur all their expenses earlier than they've actually submitted expenses. That is not something that's available with dependent care flexible spending accounts. Only the amount of the current that's currently available are available for reimbursement with dependent care accounts. So if you have, in that same situation where a participant had a a expected $2,000 expense early on. Say they live in downtown New York, Manhattan, the dependent care is extremely expensive, and they need to be reimbursed $1,000 for the first 2 weeks of the year for dependent care account, but they've only contributed $75 or $50. They can only be reimbursed $50 or $75, whatever they've already had money put in. However, with that stated, if you submit a claim that you've paid this amount, as you put more money towards it, you'll be automatically reimbursed that amount as more money goes into that account. So you'd be reimbursed $75 automatically every paycheck as you have contributed to your account, assuming that it was approved. So how can people enroll? When you're ready, you can enroll on FSAFEDS.com or by calling 1-877-FSA-FEDS. You can enroll during annual benefits open season or when you have an eligible qualifying life event during the first 60 days of employee being a new employee. FSAFEDS re-enrollment is not automatic. This is something extremely important. You do not have FSAFEDS in 2021 unless you take an action. You must actively re-enroll each open season if you want to have a flexible spending account the next year. This is particularly important with carryover, which I'll be discussing shortly. So you have the ability to make sure you have funds from the previous year available in the next calendar year. After your enrollment becomes effective, you can begin to incur eligible expenses and file claims for reimbursement of what you paid on them. You can submit receipts online through our smartphone app, which is available on Android and iPhone, by fax, or by mail. There's even an easier way of getting reimbursed, and it's called paperless reimbursement. With paperless reimbursement, you don't have to submit claims because your insurance plan submits them for you. Many of our large FEHB plans and most FedVIP dental and vision plans participate in paperless reimbursement. We have a complete list of the plans that do participate in paperless reimbursement on our website, www.FSAFEDS.com. What I want to point out is this is only for the plans that participate. If an employee is enrolled in a plan that does not participate, paperless reimbursement is not eligible. So suppose you have a doctor's visit with a copay of $35. You pay the receptionist $35 while you're at the doctor's office. Your doctor tells your health plan that you paid $35 for the office visit. This usually happens electronically because your doctor's office will submit a claim electronically to your healthcare plan, and they will be made aware that, hey, this person with Blue Cross Blue Shield, with Kaiser, whatever healthcare plan, just paid $35 for this expense. This is to ensure that this is the correct amount. It's something that your health plan does for clarification reasons and to validation reasons for each expense. Your health plan tells FSAFEDS after that you paid $35 for this eligible expense. Then FSAFEDS takes $35 from your flexible spending account and transfers it electronically to your checking or savings account, whichever you chose when you enrolled in the program. You get an email saying that you've been reimbursed. It's paperless, it's effortless, and it's $35 tax-free. And it's not just doctors. Dentists, optometrists, hospitals, even pharmacies work with participating plans on paperless reimbursement. So it saves participants time and money. So they don't have to run around and make sure a receipt was filed or was not filed. I do tell people that just for your own records, just to keep the receipt until you've seen that you've been reimbursed. You can see a complete list of participating health, dental, and vision plans and paperless reimbursement on our quick reference guide available at www.fsafeds.com. So what is the benefit period for FSAFEDS? If you enroll in a healthcare or limited expense flexible spending account during the 2020 open season, which is another 2 months now, eligible expenses can be incurred from January 1st, 2021 through December 31st, 2021. You can submit your claim for reimbursement of these 2021 expenses by April 30th, 2022. So just to reiterate, you would incur them January through December, but you have an additional 4 months to submit your claims. Any expense incurred outside of that 12-month window and any claim received outside of that 16-month window will be ineligible for reimbursement. So occasionally what we'll have is someone that didn't pay attention to their records and said, hey, it looks like in 2019, 2017, oh, actually, recently I got a 2017 email saying, I realized that I forgot to submit, no, I think she said she forgot to submit a claim from 2017 and was looking to get reimbursed now. Unfortunately, that's no longer reimbursable. In that case, for a 2017 claim, she had until April 30th of 2018 to submit that claim for it to be valid. After that date, you can no longer submit it and you are out of any funds associated with that. That does not affect your appeals rights. So if you submitted something April 29th and then that gets denied, you can still appeal and go through the appeals process past April 30th. You just had to submit the initial request before April 30th and still be within your appeals rights. The time frame associated with these dates are not picked by OPM. These are all with IRS regulations. We can choose something, either carryover, again, which I'll be discussing briefly, or an extension period of time where one can submit claims. We have carryover with our program. As a result, it's outside of our ability to make changes. So even if we'd love to, which we would, we cannot make a change because it's in the IRS regulations. All right, so where was I? If you haven't exhausted your healthcare or limited expense accounts by December 31st, FSAFEDS will automatically carry over up to $550 of unspent funds into either a healthcare or a limited expense healthcare account in 2021. To be eligible, you must be employed by an agency that participates in FSAFEDS and actively making allotments from your pay through December 31st to use carryover. You must also actively re-enroll in healthcare or limited expense healthcare account during the 2021, the 2020 open season to use carryover. Your re-enrollment must be for at least a minimum of $100, which is the minimum for our program. If you do not re-enroll, or if you're not employed by an agency that participates in FSAFEDS and actively making allotments through December 31st, your funds will not be carried over. So essentially that means if you have funds available up to $550 and you're still employed by an agency that's covered, and you're still making deductions, just re-enroll for the next year and you can carry over that $550 from 2020 into 2021. The maximum for flexible spending accounts is $550. So if you had $600, 50 of those dollars could potentially be lost if you do not incur expenses before the end of the year. And you sign up for carryover and are eligible for carryover. I have a question.
Yes, we've had a couple questions that are within the last two slides, so I think
Okay.
that's to address now before we move forward. The first one has to do with paperless reimbursement.
Mhm.
And it said, how does it work for employees that work overseas? Are they eligible for paperless reimbursement too?
For the first question, the answer is yes. The reason why we have paperless reimbursement is for a lot of reasons, for people that work overseas, for people that work in remote locations. Every one of your claims that you use your healthcare account for, you provide your healthcare card, your dental care card. That information is transferred to your healthcare provider, whether it be dental, vision, or health. And then that information is used for paperless reimbursement. As long as your healthcare provider is made aware through their system that you are using the benefit, that is what allows us to do paperless reimbursement. So if you had if you were in, I don't know, to give you an example, if you were in Paris and you had a medical emergency that was covered in your health plan, whether it was covered or not, that information, and they took your card and they tried to run it to get paid. That information is sent to your healthcare provider, and they see, okay, it looks like Jane Doe spent $500 for her copay for this, because they required it when you went there. That would automatically be reimbursed because your healthcare provider had been made aware. There are some situations where you did not provide your healthcare information and they would not have that information. In that case, you would just do it manually. It works the same way with over-the-counter medications. So you don't use your GIHA card, your Blue Cross Blue Shield card, your whatever health plan you're in card when you pick up Advil, or you pick up a first aid kit, or you pick up insulin possibly. So what would happen is, since you just have a receipt, you would still submit that receipt. What I personally do is I use the FSAFEDS app. So once I buy something, I take a picture of it and submit the claim from my phone before I leave the store. And I usually get paid within 72 hours approximately. There's another question?
Yes, we have a couple that have to do with carryover. So the first one says, does the carryover amount have to be spent by April 30th?
No. What happens with carryover is this. Carryover doesn't automatically go into your account the next year. There's still a period of time where we don't know if you will have any more expenses from the previous year. So let's use this year as an example. For 2020, let's say you have $500 in your account at the end of December 31st. That money is eligible for carryover if you signed up and did everything else that you need to do to be eligible for carryover. But from January 1st to April 30th, we don't know if you're still going to submit a claim from last year that you forgot to submit. Let's say you had some over-the-counter medication that you bought. Let's say you went to a chiropractor and you had a receipt because they didn't accept insurance to that chiropractor. So we have that money on the side in case you submit any claims against 2020 that you had not submitted yet. Then after April 30th, we start reimbursing from that $500 account with whatever you enrolled in for the 2021 year. So yes, it's available next year, but you may not see it actively because we don't know. We still keep that money aside because your 2021 funds can't be used for 2020 expenses, but your 2020 expenses still can be used for 2020 expenses. So we keep that aside just in case you have some expenses from the previous calendar year that would allow you to be reimbursed from that year.
Okay, another question concerning carryover. From the example you just gave, Is it true that the current carryover amount is $500 for the year 2020?
For funds contribute, it's been changed. IRS changed this regulation earlier this year. For funds that you have in 2020, you can carry over $550 to 2021. But for the previous year, if you had an account in 2019 and you had carryover into 2020, the limit was $500. So this is something new. It's now $550. So you can carry over up to $550 from this current year, 2020, into 2021. Do you have another question?
Yes, we do. Based upon that, do we know yet, is the carryover for 2021 to 2022 going to stay the same at the 550 due to the CARE action? Do we know the year ahead yet?
We do not. The way it will work going forward is if you do some quick math, 550 is 20% of 2,750, which is the maximum. What the IRS has stated going forward is 20% of the maximum for healthcare flexible spending accounts will be the carryover amount going forward. So if the IRS changes in 2021 the maximum for healthcare flexible spending accounts, it will also affect the carryover amount for that. But since the IRS usually makes that decision typically around October of the year, we will not hear back about that possibly until October of 2021. Looks like we have another question.
Sorry, everyone, I forgot to mute on that last one. The other question that came up was someone asked is, will FSAFEDS have a debit card for 2021?
We will not have a debit card for 2021. We will remain with our current options, which are, again, online, by the FSAFEDS app, by fax, by mail, and with paperless reimbursement. In 2021, we are not scheduled to have a debit card. Okay, I'm going to move on to what is the benefit period for dependent care flexible spending accounts. So if you enroll in a dependent care FSA during 2020 open season, eligible expenses can be incurred from January 1st through March 15th. So that's January 1st, 2021 through March 15th, 2022. You'll note that this is a little bit different than healthcare flexible spending accounts because with dependent care accounts, there is a grace period instead of carryover. So you have an additional 2.5 months to incur expenses. So to give an example for this year, because I'm sure you all are getting questions from your employees, I have a dependent care account. I don't know if I can use all my expenses by the end of the year. They don't have until the end of the year. They actually have until March 15th of 2021 to incur expenses against their 2020 dependent care flexible spending account. So as things begin to open up again, they do have additional options. Any expense incurred outside of that 14.5-month window, any claim received outside of that 16-month window for filing claims will not be eligible for reimbursement. Note how dependent care FSAs have a grace period allowing you to continue to incur eligible expenses through March 15 of the next benefit year. By law, dependent care FSAs cannot have carryover. So Again, there is no carryover dependent care. If you have money, you have to use it by March 15th of the following year for that plan year. So what I have failed to talk about yet is something called the use it or lose it provision in the IRS's regulations. As a word of caution, once the deadline has passed for incurring eligible expenses and filing claims, IRS law states that you forfeit any money left unclaimed in your flexible spending account. You do not get it back. So there are no reimbursements associated with that. But there are a few things you can do to minimize the risk of forfeitures and take full advantage of the benefits of your flexible spending account. First, you can calculate the estimated expenses carefully using the online calculator at www.fsafeds.com. Second, you can contribute conservatively. So if you think you have $500 of eligible expenses next year and you're worried about forfeiture, you can create a $400 account or a $300 account just to be sure that you'll spend it all. Specifically with a healthcare flexible spending account, you also have the added benefit of carryover. So some people choose to do a few $100s more than expenses that they expect for healthcare expenses. So if in the same situation, if they had $500 of expenses expected for next year, they may do $800, $900 because if they know if they use all of that $500, they still have $400, which they will be eligible for carrying over, which will be eligible to carry over, considering that they still remain eligible. Third, again, remember about carryover and the grace period. They're there to protect you just in case you overestimate your expenses for the year. Finally, have a backup plan. If you have more than $500 in your healthcare, $550 in this case now, in your healthcare account in December, stock up on eligible expenses like a first aid kit for your home or your office or your car. You can buy hand sanitizer. That is an eligible expense without a letter of medical necessity. An extra pair of glasses in case you lose the pair. By using all these strategies, you can minimize the risk of forfeiture and get benefits of the FSAFEDS worry-free. What I want to note with the use or lose it provision is it's an unfortunate part of all flexible spending accounts. We try our best to push it. If you are enrolled in FSAFEDS, you'll know that we send out a lot of emails towards the end of the year giving people ideas of how to spend money. We do not want to keep the money. We do not want to issue that money, take that money and use that towards lowering expenses as we do now. We prefer for every individual to use every dime of the money that they contribute. It's up to you as people in the human resource office to point out all the eligible expenses that participants can use. On our website, www.FSAFEDS, we have a benefit officer section, which actually has some pre-written emails that can help you bring up points about FSAFEDS, using your money. All you have to do is copy and paste and send it out to your people. Our goal is to have everyone use the money that they've contributed because this is the benefit that, in my honest opinion, everyone can use. One last point on flexible spending accounts. These are some of the agencies with the highest enrollment in FSAFEDS as of about July of this year. 60% of Federal Reserve Board employees are enrolled in FSAFEDS. 50% of Commodity Future Trading Commission and the Federal Trade Commission. 46% of the National Credit Union Administration. 47% of the International Trade Commission, and 37% of the Import-Export Bank of the U.S. So if you look at these agencies, what do they all have in common? They are all financial, trade, and investment agencies that employ accountants, tax lawyers, and number crunchers. These employees know money, and they know employees, and these employees are enrolled in FSAFEDS. The people that know finances, the people that know the benefit of saving, use this program. Yet the enrollment rate government-wide is only 18%. So what do these finance employees know about FSAFEDS that you don't? Hopefully nothing, because you just had this presentation. So resources. We offer a bunch of resources. Like I mentioned before, on our Benefit Officers Toolbox at www.fsafeds.com, you can order marketing material. That's posters, that's flyers, a number of other things. You can update your contact information. Our contractor sends out information to human resource officers and benefit officers concerning news and changes. And you can get that information sooner rather than later. You can see the agency point of contacts. You can see our benefit administration letters. We also have OPM resources, which is a program overview, which can be printed out, and FSAFEDS flyers that can be printed out. Those come out with the open season BALs every year. So approximately in late September through mid-October, there will be some flyers that go out in a benefit administration letter, which you can use to send by email, just to remind people this is a program that they can use. So other context. For participants, you want to point out that it's 1877 FSAFEDS. That is the main number of line. Again, that's available from 9 a.m. to 9 p.m. Eastern Standard Time. There's a TTY number for hearing impaired people. Benefit counselors, again, are available from 9 a.m. to 9 p.m. And then there's an OPM email address. That OPM email address goes to me. I am the primary point of contact for the Federal Flexible Spending Account Program. I want to ask that everyone, if you have questions, I'd be happy to answer them, especially if you're in a human resource or a benefit officer role. But please do not share that in a group email to your staff. That's happened a couple times this year. And since I'm the only person that answers it, it can be a little cumbersome to get 70 emails about something that is all asking pretty much the same question. And it's only me, so I appreciate your help on that. And that is the end of the presentation. I'm going to open this up to some questions. Please post them on the website board. While I wait for a few questions, I have a few things I want to address. First, as you know, there's been some changes associated with our FSAFEDS and all flexible spending accounts this year as a result of COVID. As of right now, we've reached out to the IRS to see if there's any impending changes, and we were told that there are not. At the time, we did that earlier this summer. If there are changes, we will certainly let you know. That will come in the form of a listserv and or a benefit administration letter. Right now, there are no changes associated with the expenses or the time frame to submit claims outside of that dependent care flexible spending account for 2019. So there are no new changes. If there are changes to that, we will certainly let you know, and that will come over again through a listserv and or a benefit administration letter. So it looks like we have a few questions.
Yes, there were a couple that came up that we had passed the relevant slide, so I wanted to wait until the end. And this, I know we talked about this quite a bit, but concerning cosmetic surgery, something came up was, what about cosmetic surgery following a medically necessary procedure such as a mastectomy? And we know that is different. Could you just do a quick overview of that?
That is a different item. When we think there are things like that are covered, we have a little bit more details on our website under eligible expenses. But there is a difference between something that is what's the word? Something that is completely voluntary and something that you were not necessarily looking to have until a illness or a sickness of some sort. So there's a difference between having a rhinoplasty for cosmetic reasons, solely because you prefer your nose to look a certain way, and a procedure as a result of a car accident, just to have it your nose to look properly as a result of a car accident. So there's a dichotomy between the two, the required and the cosmetic that is not completely required.
Right, as somebody added, perhaps like a deviated septum.
Yeah.
And someone was asking about Lionel's, sharing Lionel's contact information. And as we mentioned, that he has that FSA at opm.gov is the best way to reach him. He reviews that email box, and that's how we would get the emails to come to him.
Yes, so in case you couldn't hear that, that is the best way to contact me or have a question. Again, that is FSA at opm.gov. It's what you have on your screen there. And again, please limit that to HR contacts and human benefit officer contacts. Unfortunately, there's only one of me. And as you saw, there's 475,000 people that are enrolled in the program. So I'm not capable of answering every question from every employee. That's why we do have a 1877 FSAFEDS number for participants. This is for a question that you may have about policy regulations and things that are coming down the pike. I'm always here to answer your questions. I always make myself available for those questions. I don't know. Oh, I could not see that. Oh, so you had it looks like there's a question about deemed medically necessary. For the purposes of like cosmetic items, again, this when you have a completely voluntary cosmetic item occur, that is something that is not covered. When it's something that would be deemed medically necessary, like some changes as a result of mastectomy, we can't have that covered. And I just saw something pop up. My full name is Lionel Jones, but again, the best way to contact me is at FSA at opm.gov. Again, that's OPM. I'm sorry, why did I just read that? I said that wrong. F as in Foxtrot, S as Sierra, A as in Alpha, at O as in Oscar, P as a Papa, M as in Mama, .gov. So FSA at opm.gov, and I'll be there to answer your questions. If it's just a general question that employees have or about their account, the best way of getting that answered is to have that employee reach out to our 1877 number. And again, that is 1-877-372-3337. And that equates to 1877 FSAFEDS. I don't have direct access to anyone's information. Let's see any claims that have been submitted. That's held by our contractor, and our contractor would have to answer that. So for the purposes of questions about like a claim, any of those things, you want to have participants reach out to the 1877 number. And they can do that online or by calling. You can also submit an email. Participants can also submit an email if they log into their account at www.fsafeds.com. So they can submit a question that they have about their account. But I'm here to answer any question that you may have about policy regulations or some general knowledge about what's happening. If you've had 2 or 3 issues that have occurred and you see some sort of pattern, I'm always here to see if I can help out and resolve those issues. Do we have any more questions? All right. Well, since looks like we do not have any more questions coming in, and I'll give it another few seconds. But I do want to say how much I appreciate you attending. We had approximately 250 people that were scheduled to be on this call. I hope this knowledge was useful to you. If not, I do want to hear feedback, and that's whether it be positive, negative, or in between. What I like to say is there are two benefits, both the FSAFEDS and the long-term care program, which are the most underutilized benefits of for all federal employees. These are benefits that we rely on you at the human resource level, at the benefit officer level, to tell people about. These are benefits that can only be positive, specifically about FSAFEDS. There is no cost associated with FSAFEDS for participants. When people elect, let's say, $1,000 towards their their FSAFEDS account, they don't have any additional processing or administration fee that they in particularly pay. So the $1,000 they put in is $1,000 that they can be reimbursed. This is basically a no-lose situation for expenses associated with your account. And we just need people to be able to inform employees the benefits of our programs, because you're the people that they see from day to day, or maybe not see right now, but you're the people that they contact from day to day. They want to know why they should consider FSAFEDS, and to be able to tell them, hey, well, yes, you are a 23-year-old, recently graduated college student that just joined your agency, and you don't expect to have a whole bunch of expenses, but you can use this for your allergy medication. You can use this for massage therapy. So if you want to go see a masseuse every 2 weeks, associated with your paycheck, you can see a masseuse and have that covered on FSAFEDS. If you want to have medication in the house because you don't expect to have any real expenses like NyQuil, DayQuil, headache medicine, menstrual care items in the house for the purposes of FSA for your household, you can do that with the program. And you can do as little as $100 in a year. I personally don't know anyone that has less than $100 worth of medical expenses each year. Even if it's just something as simple as, your co-payments for your dentist, the co-payment to do an annual physical, or to get some lab work done with your healthcare provider. $100 can go very quickly, and you can save that. It looks like a question came up concerning lose it or lose it. It went away too quickly for me to see. Oh, okay. One of them, or?
Yeah, so this, there's two, we'll do the second one first, just because it was just what Lionel talked about, because someone's saying it's the use it or lose it risk. I'm a healthy person, and it wouldn't be a dependent care expenses, so it sounds like it would be a health care account, and it sounds like what you just provided gave a lot of information on.
Okay.
You can start low at 100 and go up to 500, and you won't lose it.
Yeah, the way I'd like to see it is, if you are a young, healthy person and you really don't believe you're going to have a bunch of expenses, what you can do is elect $100, just $100. Those funds can carry over as long as you stay employed and sign up again each year. You can essentially have 5 years of no expenses covered if you elect $100 each year and not lose a dime of your healthcare flexible spending account. And that would be, to me, a miracle if you could not have any healthcare related expenses over a 5-year time frame. So yes, there's benefits associated with you would not lose it if you have carryover and you did something like the minimum associated with that account.
Right, and along those lines, once the money is in the account, someone brought up the question of, they just said, I may have missed the answer, but can anyone stop it and draw the money out?
I'm not exactly sure what you're stating there. With carryover, there are very limited times where you can stop your expenses associated, well, not expenses, I'm sorry, your allotments associated with our program. It's in our terms and conditions. When you elect it, you're electing it for the year. You can do something like do a limited time frame to have all the money taken out. For instance, if you had, let's say you have an employee that plans to retire in 2021. He expects to retire, let's say, June 30th of 2021. What he can do is he can have his contributions taken out all prior to June 30th and incur expenses all prior to June 30th, and basically use all of his allotment before he leaves. I saw a listing about leave without pay.
Yes, the next question that just came in, when an employee goes into a leave without pay status, for example, 3 months, how do they make up their missing deductions?
Okay, there are two things with leave without pay. First, to answer your question very specifically, if you go on leave without pay, when you come back, your allotments will be recalculated. So what you have left to pay into your account will be taken out through December 31st. So let's say someone, and this is a very extreme example. Let's say someone elected a $2,000 healthcare flex spending account during open season. They go on leave without pay from January 10th through July 31st. When they come back August 1st, he or she would have their election recalculated. So all of that $2,000 gets taken out. That hasn't been taken out. I think maybe $100 has been taken out from August 1st through December 31st. So whatever they were initially told concerning, oh, it's going to be about, $100 per paycheck or $75 per paycheck, that will be recalculated. So it now might be $150 per paycheck to get to that amount. In addition, with leave without pay, you cannot incur healthcare expenses while you're on leave without pay. So if a participant knows that they're going to likely be on leave without pay, they can incur while they're still working and leaving pay and duty status, and they incur after they come back into pay and duty status. But while they're on leave without pay, they cannot incur eligible expenses. Even if expense would otherwise be eligible while they're away, they cannot use that to get reimbursed during that time frame. Any more questions? Okay, with that stated, it looks like we reached the end of our presentation. I want to thank everyone that has been able to join. I encourage everyone to leave feedback. I'm always looking to grow. I always want to know what can be improved. And if you enjoyed the presentation, I believe that's going to be coming via email to you all that participated. Again, thank you for being part of the presentation. And everyone, have a great day. Bye, everyone.